Unless you're a hermit or have been living under a rock, you know that the launch of the Affordable Care Act did not go very smoothly. Some people called it a disaster. In October and November of 2013, when the exchanges were opening, the first week were terrible. The website didn't work. It froze up. People spent hours. They couldn't get to the call center. It was really bad. And it caused many people to doubt the long-term viability of the Affordable Care Act. In addition, there were numerous parts of the law that were being delayed, amended, or scrapped. For example, the administration delayed the employer mandate a whole year. It didn't have to be this way. There's nothing inevitable about the implementation problems. The law is complex. It tries to reform a $3 trillion industry. Nonetheless, its provisions did not have to mean some bad problems around the exchange. Some state exchanges worked very well. Connecticut's, California's, Kentucky, they ran pretty smoothly from day one. They weren't flawless, but they ran well enough and they did not freeze up. So why did the Affordable Care Act and healthcare.gov roll out so badly? Well, we can try to isolate 3 factors that contributed to the bad rollout. The legislative process did not create a bill conducive to implementation. The politics of the moment, the politics surrounding the Affordable Care Act, the politics going into the rollout was poisonous, undermining effective implementation. And finally, there were decisions and management structures created by the administration that also prevented effective implementation. Let's look a little more depth into each of these 3 problems. First, on the legislative process. Implementation is never the top concern for Congress. Getting a bill passed, getting a bill through all the committees, through the House, through the Senate, through conference, that is the number 1 concern. As people often say, it's better not to look at the sausage being made when you make legislation. And typically, how it's going to work, how easy it is to implement, is not one of Congress's chief concern. Second, various provisions of the Affordable Care Act were not written to optimize implementation and enforcement. The employer mandate, for example, required large employers with 51 or more employees to provide health insurance to their full-time employees, where full-time was defined as working 30 hours or more a week. Well, what do you do with workers who work for 29 hours one week, 32 hours the next week, and go back and forth? Enforcing that, creating regulations, is pretty complex. Finally, there was the aspect of the legislative process that really undermined fixing some of these problems. Remember, one of the key rules about passing legislation is speed, doing it fast before the opposition can crystallize. And in the White House, this important proviso was enforced by Phil Shalero, the head of legislative affairs, where he constantly said, just let's get it passed, we'll work out the problems in conference, we'll work them out once we have the bill passed. Unfortunately, because of the election of Scott Brown in Massachusetts, there was no conference. The House had to adopt the Senate's bill, and a lot of the problems that everyone knew about just could not be fixed. The second major factor is the politics of the moment. It's plausible to say that the politics in the United States are more heated and poisonous than at any time since the Civil War. Republicans, not a single one of them ended up voting for the Affordable Care Act, and since its enactment, they were determined to delegitimize it as a bill. They voted to repeal it over 40 times. They tried to do many things to obstruct its effective implementation because they knew very clearly, once the exchanges opened up, once millions of Americans got health insurance through the exchanges or Medicaid, it would be virtually impossible to undo the Affordable Care Act. So that turned up the heat, turned up the rhetoric, and made them focus on any potential flaw. In response, Democrats and the administration became very cautious, avoiding any additional criticism of the Affordable Care Act, and that meant reducing publicity. In addition, there was the fact that no one anticipated when we passed the Affordable Care Act that so many states would opt out of creating their own exchange and entrust it to the federal government. After all, most of the states had the authority and the possibility and funding from the federal government to create their own exchange. But red states, conservative states, normally very jealous of their prerogatives, refused to implement the Affordable Care Act for political reasons, defaulting to the federal government. As a consequence, in 34 states, the federal government was running the exchanges either alone or in partnership with the exchange. No one anticipated it would be that big. 2012, the year before the rollout of the Affordable Care Act, the president was up for re-election, and there was an attempt to reduce pushback from around the Affordable Care Act and to minimize criticism of the Affordable Care Act. As a consequence, one of the things that didn't happen was publishing the concept of operations and the charts related to how the exchanges would work, for fear that they were so complex people would attack the bill as being very complex, just as they did President Clinton's reforms. The administration didn't solicit feedback on the website design, again, trying to minimize public exposure to it so it wouldn't be criticized. They didn't bring the insurers in early in the process to get them to evaluate the exchange and to get their criticism and advice, again, to minimize the public exposure. They delayed issuing a number of regulations on essential health benefits, network adequacy, and other things to minimize the public discussion of various controversial provisions of the Affordable Care Act. The result was delaying implementation, delaying key decisions, delaying the ability to test out the exchange rapidly. Finally, the third major factor in creating implementation problems was decisions made by the administration in how to staff the Affordable Care Act implementation and how to manage it. Right after enactment of the Affordable Care Act in the spring and summer of 2010, many people recommended that the administration create a CEO-type position to run implementation of the exchanges and to run implementation of other aspects of healthcare reform. But the administration decided not to create that CEO position. Similarly, there were Roosevelt Room meetings after passage of the bill focusing on implementation. Unfortunately, the senior, important, politically powerful administration officials stopped going to those meetings and they fizzled out. The result is a lot of key decisions were being made at a relatively low level. Finally, without a CEO, without major figures in the administration participating in implementation, the whole implementation effort was led by policy advisors not used to dealing with outsiders and with very limited management experience, especially interaction with insurers and the private sector. These policy advisors also did not have a lot of experience of how to manage vendors. Like all exchanges, healthcare.gov did not create inside government lots of the products needed. They actually outsourced to the private market things like design of the website, integrating all the factors, relating the exchange to the private insurers. Those vendors need to be managed very carefully and need to be integrated. And policy analysts for the government did not have a lot of experience in managing those kind of vendor relationships. The consequence is it didn't go very well. October and November 2013 led to a very bad rollout, bad press, bad branding, and a lot of people saying that the Affordable Care Act was dead. The president appointed a trusted advisor, Jeff Zients, with private sector experience, to manage the resuscitation of the Affordable Care Act and the exchanges. Jeff Zients led a team of technical specialists along with Optum and their private sector experience to revive healthcare.gov, to make it work smoothly and allow people to shop again. It worked. By the end of November, the website was up and people were able to shop much more quickly. The result has actually been a pretty big success. 4 years after passage of the Affordable Care Act, things are moving in the right direction on the three major pillars: access, cost, and quality. On the access side, when the Affordable Care Act was passed, about 16.4% of Americans reported to the Gallup organization that they didn't have health insurance. And over the few years after passage of the Affordable Care Act, that went up to a high of 18%. Since opening of the exchanges and expansion of Medicaid, there has been a steady drop, as you can see on this graph, of the number of people reporting that they've been uninsured. On the access metric alone, the Affordable Care Act actually has been pretty successful despite the bad rollout of healthcare.gov. On the cost control side, there's also been a pretty good response. In fact, healthcare spending as a proportion of GDP has held pretty flat at about 18%. More importantly, as you can see from this graph, healthcare costs have actually moderated. In the blue, between 2000 and 2007, we've had actually high healthcare inflation. That came down between 2007 and 2010 with the recession. But you can see after passage of the Affordable Care Act in 2010 to 2013, a really slowing of healthcare cost growth. Now, this won't last forever unless more is done, but it again is in the right direction of controlling healthcare costs. And finally, on quality, as we have seen, there's been an important improvement on hospital-acquired infections and patient safety when they go into the hospital. In addition, there's been a steady decline because of the Affordable Care Act of hospital readmissions. So overall, at 4 years, despite a very rocky rollout of the exchanges, there does seem to be the healthcare system going in an important positive direction on access, cost, and quality. There are many more things to be done, many more things to improve. You can't just stop with passage of the Affordable Care Act. The exchanges need to be constantly updated and improved, and there have to be more efforts on quality and cost control. Next, we're going to look at Healthcare Reform 2.0. What can we do in addition to the Affordable Care Act to improve the American healthcare system?